So when I first come in, always just you know, you might maybe let them know you're here, and then you kind of, you know, if they're not face down, I tend to just touch the body, kind of all over, just to see what the tissue feels like. Okay. And just palpate, yep, palpate a little bit. And then I might say, okay, I'm gonna have you take 3 deep breaths. And then as they exhale, I'm moving down. And moving down. Okay, 3 times like so. All right, come on up to the top. Find GV20. Okay, at the top of the hairline, you guys all comfortable finding that? If you split the ear in half and go right up top like a headband, pressing right up there, you should be pretty comfortable with that. And that counts as a point. Okay, and then at that point, if you're watching the desk, okay, have you take another deep breath. And then I'll take another deep breath.
Question.
And then after parking lot, and then press.
Can I say it so we can write it?
Yep.
Do we have to find a certain number of points during this massage?
Nope.
Sweet.
No, I'm not going to stress you guys out in that way. Okay, so pressing all overhead. So remember, it's pressing. You could do a little knead there if you want. Just pretend you're not trying to mess a person's hair up and you're trying to press. Okay, all around gallbladder channels. Okay, pressing, alternating. Like so. Okay. From there, I would do a little bit of just a little something at the shoulders before I just go and just take the sheet off. So from here, then sheet would come off, tuck, and do all the nuances in here, and then I'm back up here at the head. Let's see. Yeah, go ahead. You read along.
Yeah.
Good, and then we're here. And then we're 3 in pushing. A little bit of oil, just enough for your hands to slide, okay? Should be some friction. Just like when I showed you down, pull up and around, down the back of the arms, and up here, okay? Here, swoop the side, gallbladder, back the arm yin.
Do you go over the glutes when you do that?
Here.
No, Lisa.
Push down,
She's draped.
right to here, SI joint. Swoop around.
Okay, so yeah, you keep your fingers up.
Yeah. Okay. Down the back of the arm. It's kind of like Swedish. We just add the arms. Just go as far down the arms as. If you can't reach, you can go like so, and then up, and then the next time here and here.
And then knead and press both shoulders with palms. Cat knee. Pressure alternate between hands.
Right here. Kneading. Okay.
And then perform alternate kneading pressing technique with the fists.
And then here.
Move medially to the neck area.
Mm-hmm.
Yeah, so left.
And then here. And then now you can remember I was saying you guys can grasp here with one hand if you just to get a little more thorough. Or if you want, you can do 2 hands.
And then you can use grasping with interlaced fingers on the back of the neck.
Mm-hmm. And grasping interlaced fingers right here at the neck. So typically the reason why we have you go into the shoulders and then the occiput because you get a little better release on the neck when you loosen the traps and then come to the occiput. Okay?
Roll both shoulders simultaneously.
And don't worry, I'll show you guys little nuances in between even this stuff, okay, on how to really get in there. Okay, so I've kneaded, press, grasp. You notice grasping turns into kneading as well. And then I'm just gonna roll right on. Okay, try to get up high up on the shoulders as you can. Roll like boom.
And then press GV21.
Good, and GV21 at the seam of the shirt. So just find that high point of the shoulder where it might be tender. This high point on meaning the top. Here, this side, just below the earlobes. And just press and knead in there with your thumbs, okay? So you're basically loosening up the broader tissue, and then you're aiming to work in more specific. Points just take you more specific and get a little bit deeper. Okay, deep breath. So if it's tender, a lot of times people will start holding their breath when you hit 21. She did it. Good, there she goes. All right, now we listen. Okay, what's next?
Move to stand at left side facing client's head.
Okay,
And then from there, use knuckle grasping technique from shoulder to neck. Alternate grasping trapezius muscle with hands, top of shoulder and back of neck.
oh, I jumped the technique then, I think. That's fine. So here, and then knuckle like that. Get in there. Wring it out. Okay? How's the pressure?
Great.
Okay. Good?
And then move to stand at head of client, roll down the entire back using any rolling technique.
Okay.
I like the knuckle one.
Alright. The last one where I grabbed the shoulders, it was supposed to be here. Grasping on the neck. Sorry.
That's okay.
Okay, so it's grasping here,
Should we write that in?
here, and then here. Okay? Alright, and then we're gonna roll down the entire back. That's knuckle, loose fist knuckle rolling. What's the name of it? What's the Chinese name?
Gunfa.
Gunfa. Good. What's grasping?
Anfa?
Good. Nafa.
Nafa.
Nafa. What's kneading? Ralpha. Okay, so see how I did that one? 1, 2, 3. Okay, so you're rolling down. And you might as well just take advantage of that you just rolled down, now roll back up. Okay? If you don't feel comfortable with that, you certainly can roll down, drag back up and start over. I just figure use the efficiency of time and get it in. Now, you certainly could go 1, 2, 3. Be done with it. Okay? But rolling feels pretty good and it starts to really get things loose. So depends on what tempo and pace you're working at. Okay, good. We have rolling.
Then return to stand at client's side. Press the vertebrae space of the spine from lumbar to neck.
So we go rolling and then we walk the dragon. In between each vertebra. Pressing up. Okay, good.
And then press up along both sides of the spinal column
And
with
then we
crossed
go-
thumbs.
And then eagle claw. So, boop, boop. Here. Kind of using like a vice grip. A vice grip. Good?
And then use cross palm kneading technique on the whole back. I have a hard time with this one.
Cross palm kneading.
Yeah.
Okay. Now remember, one hand is straight, the hand that's close to you here, here and here. Pinkies were twisted together, yes. Okay, now I'm going to go to the other side. I'm going to cross hand here, and now my hand is like so. Okay. Okay.
Use pinching and grasping technique on the entire back, like the Swedish rolling technique, but lifting approximately every third roll.
Okay, so this is
This
where
is
you need on the skins. Okay, bring your shirt up. Okay. So I'll do it just in this area so you guys can see it. Okay, so I'm grasping the skin like so, or actually, sorry, starting at the base, sorry. Here. Okay, get a hold of it. You want to pull.
Oh, you want to be above the spine?
Yeah, because you're going to go up the spine. You can go up the side of the spine. You can go out and away. So here, and then I'm going to roll. About maybe 1, 2, 3. Oh, you hear that little pop?
Mm-hmm.
Little fascial movement there. So that's the difference. Here, and then a little tug. That was me.
Skin rolling.
And then pull.
That was him.
How you doing?
Okay.
Okay. And then, yep, roll. I'm going to sneak up here. Okay. Okay. So it's a little more intense. Good for the immune system. One more time. Get the skin. See, I'm pushing it with my thumb. Give a little tug. Roll. Give a little tug. Roll. A little tug. Okay? So you have it there. And you can certainly just do the spine. For the routine, I would say save yourself some time and maybe just do the spine. I didn't mean to run. It just keeps happening. And then you got the same thing, so you go upside, like so. I would switch and do the other side. Like so. Same idea. Okay. So the only difference is we add that little tug and we're not using any oil at all. So if you do have a lot of oil at that point, you're probably gonna wanna wipe some off. Okay, now you can, if you're going out and away, you gather and then roll out this way. Okay, and I just usually get here and then give one little tug. Here, when I can get enough skin, okay? Here, like so. Okay?
And then knead and press the lumbar region with knuckles.
Okay, so then we're here. I typically like to go right up in the corner here like this so I can knead like so. How's that feeling in your lower back? Let me know if you start feeling tight in your sacrum. Because we are pushing a lot of energy down.
Mhm.
So when people sometimes like, oh, I just feel a lot of pressure in my sacrum or SI, lower back area. It's normal. The person has a lot of energetic, just stagnation. That'll happen. So kneading with knuckles, okay?
And then stretch the lumbar sacral region with the palms and then forearms.
So palm. This is one that we haven't done yet. So here, but maybe you got it somewhere from one of the other. So I'm gripping the skin. You see that?
Mm-hmm.
I'm moving the skin. Okay, I'm not just going sliding. I'm trying to grip the skin as much as you can. Okay. As you do right on the spine like so. You go just off. And then I would come over to the other side and do here. Okay. And then, same thing with the forearms. Here. Like so. And then the cool thing is I go off to this side. Let me know if that's too much on that floater rib. Here, you see I'm palms together and I'm just pressing against my palms and that gets my elbows to spread. Like so. Okay. Same thing over here. All right.
And then use rolling technique over the entire back again.
Okay. And then that's where I might take one hand and just start. And just roll all over areas that I feel like need some attention or some love. Okay. So really in the routine, if you feel like you want to jump into rolling, go right ahead. Maybe rolling could become your segue of what you're trying to figure out what to do. Get your practice in, all right? So just when in doubt, roll it out.
You're rhyming again.
And then shake and press down the back at the same time.
Good. Now this one here. Now we want to get into those rhomboids a little bit. So I'm shaking here, and I'm pressing, kneading in here at the shoulder. And just right there, I'm hooking the erectors on the opposite side of the spine. I'm just really shaking and kneading. Okay. So. Good. And I might come to this side like so. Maybe bring the camera over here. And then I'll do it on the same side this time, and I'm kind of just grasping, and I'm not pushing it necessarily into the spine intentionally. I'm really just trying to kind of get under the erector a little bit, okay? And then I'll go into that opposite side. Just a subtle nuance, not super important right now, but down the line it will be. Okay, and next.
3 in, pushing again.
And then 3 again, pushing again. All right. 3 again. When you get up here to that swoop, remember to grab that occiput and give a little pull and knead at the occipital ridge there in that little gully, gallbladder 20. Okay? Knead in there a bit. Okay? And
Knead and press the palm with thumbs or interlace your fingers with the clients using 4th and 5th fingers of both hands to spread open palm.
oh, now we're down to the arm.
Yep, knead and press their palm.
Okay, so now I've just done their back. So now what I would do here is I'll cover up their back, and then maybe just expose the arm. If you feel like if they're feeling a little cold, if they're fine, you can ask. Just keep them undraped. It's fine, because you might want to go back in and do some work. Okay, so just keep it open. Sorry, that's such a habit. Okay, so pushing down the arm. It shouldn't. It's not pushing.
It just says knead and you do the hand and then you go to the leg.
Fine to do a sweep, after you've done all the rocking and the kneading in there, okay? And then you can cover them up if you want, and then now we're going and we're pushing 3 in, channels down the hand, of the arm or the hand, okay? Just like so. This is firm. Be careful if the person has a tiny wrist. You don't want to put too much downward pressure. The pressure should be going this way, okay? So, down towards the back legs of the patient. Get there at the palm, maybe a little press. And then it said knead and press with thumbs. So now we're here, getting that first lap. You're going to have therapists on the table, so guess what? They need work on their thumbs and all this stuff. Okay? We know that. Okay? Knead and press in there, and
Knead the wrist. And then it goes straight to the leg. So this is where I was confused. I didn't know if you wanted us to do both arms and then.
Yep. So do this one here. A little shake technique. Bang the arm on the table. Okay. Then drape them back, or if they're undraped. Okay. If not, don't worry about it. Then we're here, but you see how it's not a lot of time with them down there. Now, if I'm going to focus in on the scapular area and all that, then I would probably cover them up. Depending on the room temperature, it tends to be chilly in here, so that's why I say it. But sometimes my room gets really warm, so I'll just keep it there. So pushing 3 in again, and really again, remember you guys, you're focusing your pressure below the elbow, so all the flexors of the forearm and down. Okay, give a little press, and then we're going to knead and press on the wrist right at the crease. This happens to be PC7, which is a carpal tunnel point. Okay, nausea point is just above that, 2 thumb spaces in the wrist. Here, just a little note if you catch that. Okay, kneading through here. Nice, kneading, use your body weight. So you don't wear your thumbs out. As we use those thumbs, save them for the points. They're try to knead with your thumbs at too large of a muscle group because it just wears your thumbs up. Use your fist. Okay, so you can use your knuckles like so as well. In here. Okay?
And then you go to the legs.
Okay, so then now I'm gonna head down this leg. So I would cover them all up. Straight. Good. And now without even going under the sheet yet, okay? We're gonna do rolling, right?
Yep.
Rolling down the entire leg. Now that means from the SI joint through the glute and all the way down. Okay? So I'm here, one hand rolling. And maybe you start out a little slower with the rolling so it's not super abrupt. Now again, I like to just come back because my direction is still going this way down the bladder channel, but I'm rolling, I'm moving backwards with it. Just something to practice. Okay, so I got 2 laps. Here's the third. Okay, good. Now I'm back down the leg and then it's pressing.
Press.
Yep. So your choice, if you want to undrape the leg right here at this point, you can. You don't need to. You can keep it draped. And then now I'm going to come here. So now the sacrum is like this, right? So I'm going to take my palm just off the sacrum, butterfly, like that. Bottom hand is the dominant hand. And I'm going to press.
And your pressure is towards you.
Yeah, I'm going
Flat.
down and then like you're getting out of the swim pool. Remember that?
Oh,
Here
yeah.
and then pulling towards you. Okay, this is the pressing techniques, the Nafa, they get overlooked and they get forgotten, but they're super effective techniques because you're doing broad pressure and it really does help a person to kind of settle. And also if doing a technique that's more stroke or more movement, it might be just too much, you know, and the person might, you know, tense their body up into that, and you don't want that. Okay, so I'm moving up with this one too, and you certainly, again, you can go down. I may have done that in the routine. I may have went and started back at the hip.
Could you use a forearm on this?
We're gonna wait for the forearm.
Okay.
Yep, you certainly could. You certainly could, especially if your arms are tired or whatever. Good, and then
Use grasping technique down entire leg, both hands side by side working simultaneously.
good. So
Grasp, lift, or position hands. Grasp,
Okay.
lift.
So we roll down, okay? We press down, and now we're gonna grasp. Now, if the person's covered, now this is where I drape them. Do the whole drape, up under, here, bring it up here, okay? Now, grasping. Now we start at the hamstring as much as you can. If it's just too much tissue, you either go more here on the side, or you either go more medial. Okay, and for hers, I feel like I can get the best grasp here. Okay, grasp, lift, and shake. Grasp, lift, and shake. Okay, you're just grasping and trying to shake it loose. And you might find an area that feels a little tighter. It's okay, you can stay there. You can stay there and just grasp for a little bit. That's okay. All right. Don't feel like you have to, you know, stay for a little bit and just kind of, but just keep your energy moving. Okay, if you know what I mean, just try to keep your energy flowing so you're not, you know, sticking there. Later, yes, we will spend a good amount of time. That's why you need to work on the techniques. We'll spend a good amount of time doing one technique in one area to get the stagnation or release. So keep that in mind. Okay, so we grasped.
Stretch and press the hip and leg.
Okay, so this one, so what I'm gonna say for you guys here, I would prefer to see you guys pull and shake, just like we did the arm. Okay, pull and shake here. Then, go ahead, relax the knee. Okay, so now we're here. So we're going right into a stretch. So here's what the idea is. real quick, when you bring their knee up, is there any pain or discomfort in
Nope.
this position? Okay. I'd say if you guys bring the knee out just a little bit for them, if it goes. Okay? Now, press here. Don't worry about doing the whole lifting thing right now. Be firm on the glute, broad pressure, so we're not doing a pressure point with the elbow, we're just broad pressure. And then keep that broad pressure, and then just bring the knee towards the butt for right now, okay? Just right there, reset. Have them take a deep breath. On the exhale, I'm gonna bring that knee towards the butt. Okay, now if a person can get their knee all the way to their butt, and it's just like, yeah, I don't feel anything, okay, then we do other, and then you grab the ankle, and then we grab under here. And then you stretch this way. She's really tight, so she doesn't even need that. Okay, so you have to register the person on your table. Don't do a technique just because it said do it necessarily when it comes to stretching. Okay, but so there she is right there. But this is a good vice here, and we can go through some of that. You guys are more comfortable with that. Okay, so that's all the basic. Basic is here, stretch here. Okay, my forearm is here. Now this, what's the next one before I'm?
Grasp the calf with crossing palms.
Okay, so just that elbow is there after stretching. This is extra, right? After we did that stretch, you know, if you can look at it as the whole thing. Now I'm right here at this point here, gallbladder 30. So I would say just with your elbow, do a little kneading. See how now you asked about using your elbow? This is where the elbow comes in very handy right here. Save yourself, save your wrist, you know, your hands. And I'm just kind of kneading a little bit there, pressing. I'm pressing, and a little kneading with the elbow, okay? So just kind of working out the area, just kind of looking at the glutes as a whole, and just, you know, and then specifically the gallbladder 30, so here's the greater trochanter here and here. Gallbladder 30 is at the dimple, okay? So right in there. If they say like, oh yeah, I have, you know, a little bit of low back pain, this is where you could throw this in. Okay. So don't worry too much, and then the same, pressing the elbow down. You can just kind of follow that up. Okay, now I get to the leg. Right here. I always tend to do this as a habit, just because a lot of us get compressed in our lower backs. You know, and just traction in that leg kind of gets it. Just to settle down a little bit. Even if you are asleep, it still works. Okay, there you go. There you go. All right, so here, I'll bring this up here. Interlace finger grasping, you guys remember this one. Same thing at the neck. Okay, so I started at the bottom, moved up. That was 2. Dot, dot, same thing. Down 3, okay?
Use
In extra little.
on the plantar surface of the foot.
And I stand up, and I'm here. So if this is too high and you feel like you're going like this, just bring it down here, okay? And you can screw up right here.
What does this do?
This just warms the kidney channel. So, because remember the massage is a chi balancing massage. So there's also, you're working with the chi energy, you're working with musculoskeletal structural, and then you're also working, well, musculoskeletal, which is tissue and bone and joint. So, but also energetically. So we want to move chi, remove stagnation. This is a good one. So the kidney points are good for immune function. And right here specifically kidney 3.
On the heel.
Oh,
When I did it.
yeah, so you want to scrub right in this direction, like so. You can certainly put the foot down and do it here. I think I just did that in class. I think I showed you like 3 different ways. So you can do it here. You're already here. You can do it this way, just fine, okay? As long as you're just coming from the inside and through the arch, yeah, like that. And generate some heat. Okay?
And then you use striking technique on the plantar surface of the foot.
Striking technique. So then I bring this back up here. I can do pecking. I could do it with knuckle knocking. I could hack. Okay? And then rotate. No, they don't tell, it doesn't have all that.
And then shake the leg and ankle.
Okay, yep. So then grab here, whole leg. This is shaking the whole leg. Dofa. Yeah, we haven't gone over Dofa, but Dofa you have in TuiNa in the chair routine. But Dofa is just me shaking. Okay, and you just want to hover it too. Sometimes if you pull too high, see how her back is whole lifting here? It's because she's really tight in her hip flexor, so we're not gonna do even any that much because I want her body to kind of feel like she can relax and breathe into it. Okay, and I'll come back and show you, get you guys into some of the rotating, pressing. It's hard not to want to show you all of that. Okay, and then
Other leg.
other leg. So then we cover them up. Da da da. Same idea. Swing. Sorry, we're here. And then we're rolling down the entire leg. I'm just gonna flow through it. Okay, now we got pressing. Be careful pressing and pulling too far if you're on the glute, because I won't even say it.
Finger slip.
Well, not even the finger slip, because sometimes if they pull in the glute cheek, let's just say, apart maybe a little too far, we
Uncomfortable.
don't want to rip anything.
Surprise.
Yeah, no, you'd be surprised. You learn the hard way some things. Okay, so pressing. Okay, so don't underestimate the quality or the full expression of any technique. Okay, just try to, because one of them might start getting the release, and if it's not your sort of favorite, or it's not really a technique that you spend a whole lot of time with, kind of sucks. And it's like, oh man, I'm not good at that technique, so that's the one that's working. So, okay, good. Then we undrape the leg, do your tucking, and then grasping here. Grasping left. Grasping left. Okay. All right. Like so. Good, and then I think we had the stretch. Is that right?
Stretch and press the hip and leg.
Okay. So here, and this would just be really the height of the table too, because if it was a lot lower, I might just use my palm. But here, again, I'm gonna, so I want her hip to there. Now it's down. Now, and it's okay. Somebody, if they start wanting to help you, that's fine. Because it's just an active stretch. It is a thing. So don't feel like if they don't relax in some areas, or if they want to help. As long as you're stabilizing that hip, they're just doing an active stretch. So in some sports, to get hamstrings to activate and stuff like that, we do that. Stabilize the hip and have them move through the motion. Okay. I think maybe in the routine I did do the pulling maybe. Don't worry about it. Okay, so that's that again. So she's even tight right there, and I'm just grabbing like that, so I'm not even gonna do more. But I would go here, here, and lean to stretch her. Okay. Good. Finish it on down. Grasping.
Press the calf.
Grasping the calf. So then with interlaced fingers. Here. That's just getting a little more into the calf. Soleus. And subtle nuances. Okay. Okay. And then we have That's striking
Scrubbing.
or scrubbing. Scrubbing here. I'm gonna do it this way. Like so. Good. And we are striking.
Mm-hmm.
Again, get it here. Heck with it. That tender. Heck. Okay. Little shaky shake. Right?
Yep.
And then, or it doesn't say that.
Shake the leg and ankle.
Oh yeah, shake the leg and ankle. That's right here. So you know what, this is one way to do it. So the same idea. Or here, or and here, let's say. Okay. See how we're holding. I'm banging it into this into here, like so. Okay. Give a little tug. All right, and then
Yes, grasp and pull the ankles at the same
yeah.
time.
So okay, now we're here, and we're grabbing out either side of the Achilles. So you have bladder 60, which you'll learn is a good point for low back pain, SI joint pain, and on the inside the kidney 3 again, which is good for immune function. And then we're just opening up the yin and yang channels of the back and the inside of the legs. Okay, and next.
Chi machine.
Okay, chi machine, optional, face down. For some men, you might want to check, say, when you're doing it, ask if it feels uncomfortable. And even for some women too, if they have larger breasts, it might not feel comfortable to do chi machine when you're face down. But it's here, you just subtle. Just get the knees just slightly up. Is that okay in your back?
Yeah.
And then you just side to side. Typically, this works a lot better face up. Okay, so chi machine is in that DOFA portion as well of the book. Okay. All right. Oop.
Use padding techniques on the whole body.
This is where you get to play your hippie drums. Okay.
Has anyone ever made a comment about doing it on the boots?
Nope. You know, some of my friends make dirty comments, but you know, not usually clients. Okay.
Calm the client by sending chi.
There it goes.
Out the window.
All right, there you go.